my name is Ashley Coleman. I'm with DC Health. I'm a program manager and I'm also the LinkU contract administrator. Today, we are going to be talking about LinkU, which is a resource and referral online platform for both the residents of the DMV area to search for resources and get connected to the different agencies and community partners that they need in order to find things like health, housing, food, you name it, it's on LinkU. And then it is also a platform for those searching on behalf of clients or patients that work at community partner sites to be able to find resources for for their clients or their patients just by starting with a zip code. So I'm really excited to be here and we will jump in. So the first thing is that to note is that there are two URLs. And when I say URLs, that just means the address in the address bar. So up here is the linkudmv.org, which this site is meant for the public. So anyone that is searching for themselves would come here and they can actually search by just putting a zip code in, and they can go through all the resources by themselves. This is great for when a client is not in front of you, or maybe they're discharging from the hospital, or whatever the case may be. They don't have to necessarily have a case manager in order to use the platform. The other URL is for those who are searching on behalf of a client. So this is for all of my case managers, my peer navigators, community health workers, doctors, nurses, whatever, your title may be in your organization. If you're working as a direct service provider with clients in the community, this is where we encourage you to search for resources, because it acts as a small case management system and has some advanced features for our community partners that are actually doing that work on behalf of the client. So just so we can see what the public facing site looks like versus what the staff site looks like, I'm just going to go through the public facing one real quick. But the majority of this training will be on the staff site, which is what looks like here. And as you can see, they're both very similar. So when you're teaching your clients on how to use this site, you won't have to have two different sort of ideas in mind of what your site looks like versus what theirs is. It's pretty similar in the way that you navigate it. So right now I'm on the public site, which is linkudmv.org. You'll start with a zip code, which is, let's go with 20002. And once you put a zip code in, it will bring you to this, what I call like a landing page here. This is where you can find what I like to call quick tabs. So if you know automatically you're looking for food or you're looking for housing, you can just hover over some of these larger umbrella terms, and then some subcategories will be underneath those. So we have health. Everything, even to legal, if you're working with returning citizens or if you're working with individuals who are looking for work, or care, if we're thinking about end of life services, and even up to animal welfare services and different things like that. For the purpose of just this training, I'll go through food, and you can see that there's food pantry right here if you're looking for a food pantry that's in the city. However, if you just want to type in what you want, maybe you don't want to go through those quick tabs, you can see I typed in food, I'm looking for food pantry, and I can click on food pantry here as well. So either way, you're going to land on this. Now, based on the zip code that I just put in, these are 110 results came up. That might be a lot of results to try to scroll through. So what we've provided here is some filters to help you narrow that down if you need to. You can filter through anything from age to, gender. Maybe you want an agency that, really focuses on like emergency services or, citizenship, whatever makes sense for, yourself and this is the public facing site. So this is something that the client or the residents can do on their own. They can also filter through program filters. So maybe they want organization that's open between certain hours, maybe, open late because maybe they work a certain, until a certain time frame. And then there's also the income eligibility filter. Now, what I'll say is all of the organizations on here are either low income or free of cost. Any organization actually in the US that is registered as a 501(c)(3) is actually on LinkU. So if a person lives in, DC right now, but maybe they plan to move, to Florida, they can put a Florida zip code in, search for some resources, and they can still connect with the resources in Florida, even through this platform here. So we know that we have folks that move in and out of the city, and so this is a convenient way for both, folks who are searching for themselves to make sure that they have services wherever they go. And it's also a helpful way for those who are searching on behalf of someone. Maybe you have a client that you're working with and you don't want them to move to Florida without being connected to a primary care facility. You can still make that referral, or you can at least print out some different options so that way when they land wherever they're going, they have some options there without having to look for them when they move to a new city. So let's go down and look at some of the options here. So Thrive DC is the organization, and Emergency Food Pantry is one of the programs that they have in their organization. You can go here to kind of see a little description of the organization. You can click on more info, scroll down, and see everything from eligibility to availability, languages that they are able to provide services in, and even kind of some of the next steps of how to contact them, whether that's on their website or actually giving them a call. You can also see the address of their location. And then also what's really great is you can see the hours of operation for that particular program. So this doesn't mean that the agency is only open on Thursday, but it means that their emergency food pantry service is open just on Thursday from 9:30 to 1. Why is this important? Because it's so inconvenient. Like today, let's say today is Monday, and a client or a case manager is sending, someone to this service, and it's Monday, and they actually don't have that service available on Monday. So at least you can see, okay, Thursdays when they have it, I can go there during the times that they've set, and I don't waste kind of, my time going across town to a program that is not even available on that day. Another thing to note here is it says right here, last reviewed. Every organization on the platform is updated at least every 6 months. So when you see this here, that means that on November 21st, 2024, that was the last time that all of this information was updated and is current. And we'll get to if later in the presentation how you can make a request for certain postings to be updated if you see some information that might be out of date. Okay, so some of the buttons that we have here is if a client or somebody wants to get in contact with the actual organization, they can click contact here. And from here, they can actually make a referral. So each organization has the option of what we call claiming their organization. And from there, that means that they can enable some advanced features in which referring directly to them is one of those options. So if a client is or individual is, looking for resources for themselves, they can say, who is this for? They can say it's for myself, or maybe they're searching for their family member. They put in their information, the best way to reach them. They can even put a little comment in here, and then from there, they can, click the consent button that, they consent for this information to go to that agency. And when they click on send, then the agency will receive an email, receive that person's information, and then make contact with them to connect them to the service. You can tell when an agency has done what we call claim their agency by these little check marks in the right-hand corner of their posting. Not all agencies that claim their agency enable the referral feature, but everyone that claims it means that they do personally maybe update their own listings here. So you can see here, this particular agency has not or has the check mark, meaning that they claimed, but they haven't enabled the actual online referral option. What they say is the best way to get in contact with him for the services is to simply go to their program's website. These are the main features that we probably tell our residents of the DMV area of how to use this site. It's very, really, easy to navigate from here. If you wanted other things that you're looking for, you can go either to the quick tabs or you can go back to the search bar. Another feature to note to folks is that you can translate this whole website into over 50 different languages. So if we wanted to translate it into Arabic, and just give it a second, then it uses Google Translate to do the whole site, as you can see. And then when you want to go back to English, you just click right underneath this bar again, and then it will go back to English. Anytime that you want to go back to the home page, the DC Health logo here is considered the home button. You'll just click here and it will take you back to this page where everything began. So that was the public facing site. I'm now going to switch to the staff site, what we call the staff site. And this is for all of our community providers who are searching on behalf of clients. So the public facing site, again, is for those who are searching for themselves. So clients can search by themselves, just different residents can search by themselves. If you're searching for yourself, you can search for yourself, and you'll use the linkudmv.org website. When you are searching on behalf of someone and are connected with a community partner or at an agency, a FQHC, a hospital, a clinic, then we're encouraging you to create a account, which I'll go through here, and to use the staff site. The staff URL address is simply staff.linkudmv.org. So pretty similar to the public facing site, except it has staff and dot linkudmv.org. So I'm going to log out of my name so you can see how to create an account. You do not have to create an account on the public facing site. So unless clients just want to create an account for themselves so that they can track their own referrals, that's an option for them, but it is not something that you have to do. On the staff site, you do have to create an account. So when you first type in staff.linkudmv.org, it'll bring you to this page. If it's your very first time, you'll click sign up, which is right here. It'll have you put your first name, last name, email, a username, and a password. You'll create a password. Once you do that, you will click Get Started, and then from there, an email will be sent to you to confirm your username and your password. If you don't see the email in your inbox, the next thing to do would be to go to your spam and to see if it's there. Also, you won't most likely get an email that says like confirmation from LinkU. You'll get it from the company that powers LinkU, which is called Find Help. So when you go to your email, you'll look for an email that's being sent from a company called Find Help, which is the company that powers LinkU, to confirm your account, your email, and your passcode. And then from there, you'll be able to come back to this site, put in that information, click login, and you start your search. Again, we'll go through the steps of how to do the searches, but it is very similar to how we did on the public facing site. So we can use the same exact zip code, which is 20002. And as you can see, it takes us to the same landing page. Same quick tabs that we saw on that public facing page. Even when we go to food pantry, you'll see the same sort of results that came up for the other site. The only difference is now you're on the staff site. So instead of it just saying contact us, you'll actually see the agencies that have referral buttons, and have enabled that referral feature to come on. Oops, sorry about that. Um, so again, any agency that has the check mark here means that that agency has claimed what we call claim their agency, in which they, when you claim your agency, you're able to enable more advanced features. I'll show everyone how they can claim their agency on this training a little bit later in the training, so that way you can go into your own agency, claim certain programs, and enable certain features if that's something that you're interested in. Same situation here where it comes to more info. All of this info is exactly the same. Um, and then when you click the referral, instead of saying, I'm making this referral for myself, you're now saying I'm making this referral for someone else. It's putting your name in there. Still, all of the information about your client will go in here. You get your client's consent. You can also add a comment, and then you can click send. The great thing that happens here is now that you have created an account, you now have a small case management system that's working behind the scenes. So we'll go into where you can look at all of the clients that you're serving, and all of the different goals that they have, all the referrals that you've made. It's all stored under your account so you can keep track of their progress. Some buttons here that I didn't note on the public facing site, because they're usually not used as much on the public facing site as they are on the staff site, is the save button. So let's say that you really like working with Thrive DC. You can actually create a folder that is for like food services or food pantry. Click save. And now this particular agency is under food services slash pantry. Let's say you wanted to add Damien Ministries to that same folder. You click save. I have a ton of different favorite folders, but let's find the food services slash pantry. You click here, you save that. And now you have two agencies that you really like working with under that folder. The great thing about creating favorite folders, which is what we call them, favorite folders, is that it is stored under a live URL. So you can share that URL with your clients, you can share it with your colleagues, And you can go to it yourself so that you don't have to, every time you look for food pantry or food services, have to search for it one by one. If you have certain ones that you always go to, and they're kind of like your trusted network of food providers, then you can just send out that list of those 5 or however many that you put in your folder, to whoever you want to share it with. The second button is the share button. So if you have a client that you want to share this resource with, you can put, their email address here, a short message, the language that you want the email to go in. So if they primarily speak Spanish, then you can actually email them in Spanish. You click the consent button here, and then you'll click send. You can also do a text message to them, again, in whatever language makes the most sense to them. And then you can also share the resource on your Facebook page. If you really want the public to know about a certain resource in the community that has been really helpful to you and your clients, then you can share that so that way just more referrals and more awareness of that agency is there. The third one is almost kind of like a Yelp review, but it's only just for you, and you have the option to share it with whatever team you are a part of. So LinkU allows you to create groups. So if you are a part of an agency and you want to create a group with the folks or the colleagues at your agency, you can do that. And once you do that, then whenever you do things like this, where it says, um, how do you rate this program? You can, put 5 stars. As you can see here, back in 2021, I made a note to myself and it said like, ask April for help. Like she's very helpful. So you can use notes like that as well. This helps with, or if even you had April's maybe direct cell phone number, or maybe this particular agency works really well with returning citizens, whatever you want to put that makes it helpful for you when you're searching in the future, or even when your colleagues are searching. That's what you can put here. Again, this is not available to the public to read. It is only a note for yourself, or if you wanted to share it with like a certain group that you're a part of, so these are the different groups I'm a part of, then I can share it with my team. And so then my team can then come and see the note. They know when they go to Thrive DC to ask for April. Maybe I put a phone number in here for April, and then that helps with moving their process along as far as um, better understanding this organization and how to contact them. The fourth one is just being able to let Find Help, which is the agency that um, powers LinkU, if there's any information or anything that can be listed better. So this is where you can actually make like feedback. So if you say, hey, it looks like the phone number is wrong, or hey, it looks like, the address is wrong. This is where you can put those suggestions, and it'll be sent to the data management team over at Find Help, and they will make those corrections, and then they will also email you to let you know when those corrections have been made. Okay. Another way that you can also get this information out to your client. So if you did not want to share it as an email or a text, uh, let's say that you wanted to print, you could, or let's just say that you have multiple agencies that you want to send to your client. So let's say Thrive DC, Damien Ministries, so others might eat. So I'm clicking these boxes on the side, Capital Area Food Bank. Um, and then you can see it says that I have 4 selected. You can click on those 4, and from there you can either save and put them into your favorite folders, just like how we did before. So we find the food services pantry here, and then click save. Now, instead of doing one by one, you have saved all four in your folder. Another thing you can do is click on that same thing where it says four selected. You can email all four to the client or to whoever you're sending it to. Put their email in, a message. You can change the language again and then send it. And now instead of sending each referral one by one, you can send all four of them at the same time. And then you can also print. So maybe your client doesn't want them to be, they don't have a working email, or they would prefer to just have a printed version. You can print it here, it'll line them all up, and then you can print here. You can also change the language using Google Translate. And so again, if your client's first language is Arabic or Spanish or something different than English, you can make this to where it makes the most sense for them, right? So we don't want to send them something in English if it's not going to make um, a lot of sense as far as their understanding of it. And then whenever you would like, it'll translate it right back to English if that's the primary language of you. And we can clear all, and then that clears all of the ones that you got selected. So this is really the majority of things that you can do as far as functioning on this page. Again, you can change the language of this page right here. You can use all these filters. I think it's great to note as well that on the more info, there's a map here, and you can actually use LinkU on your phone, on your iPad, whatever device that you have. And all of this is connected to Google Maps as well. So if somebody wanted to go right then and there to the organization, they can click on the address and it'll route them to right here where it says get directions. It'll route them to Google Maps and then tell them the best route to take: bus, train, car, walking. So I'm going to move on, and I'm going to use the DC Health button as which is the home button, to go back to the main page. And again, this is just the staff site, but you can see here there's an option to do what we call a standard needs assessment. So you can click on this standard needs assessment, which is on the home page. And it will load up a needs assessment where you can start answering questions on behalf of the client that you're working with, or behalf of the person that you're working with. Again, you can translate this whole page into whatever language that makes the most sense for you and the client if you guys are doing this together. This first section here is just really getting the client's kind of, demographic information. So what's their name, their gender, their sexual orientation, phone number, email, birth date, what their address is, zip code. And if you notice, anything with an asterisk is required fields. Anything without is optional. If they live in DC, then, what ward do they live in? And if there's a particular preference on a particular language, if it's outside of English. Then it goes into living situation. So it'll ask questions like, do you have current housing? Certain questions, based on how you answer them. If you say, I do not have, stable housing, then it might bring another question to kind of follow up on that. If you answered, I do have housing, then it won't make you answer additional questions based on how you just answered that. Are you worried about losing your housing? Do you have any issues with, paying your utilities, or any of these sort of, food, clothing, utilities, childcare, an issue? Those are all things that you can indicate. Then it goes into food, and it'll ask questions about, within the last 6 months, has food been an issue to purchase or buy? Then it goes into financial situation, which is really assessing, are you employed? What is your income? As far as like how you receive income, whether it's, earned income or SSI, SSDI, or if there's other. And then just in general, is it hard to, meet your basic needs based on the income that you get? For medical needs, it's asking about, health insurance. Do you have a primary care doctor? Do you have a dentist? And then it's asking, about your ADL, so your activities of daily living, if you have any difficulty running errands or bathing yourself, preparing meals. The next section is on mental health. Then it goes into transportation, if transportation is an issue. Safety, which is assessing intimate partner or domestic violence um, sort of needs. So asking about, you feeling safe at home? Do you have a support system? It goes into substance use, so it's going to ask several different questions about everything from tobacco use to alcohol use to other drugs that might be, illegal drugs. This section is just requesting um, if there's any other issues outside of some of the ones that were listed previously. So you can click all that apply here. Then it goes into chronic disease. So it's asking if there, if any of these sort of chronic diseases are something that the client is experiencing right now or has a history of. And then the last section is legal. So, is the client in need of any legal services? Have they been involved in legal services? Again, if you click like yes, then it's going to have some drop down options there. So the great thing about doing this needs assessment is what's happening every time that you select an option that is identifying a barrier or a challenge or an issue. So let's say food was an issue and housing was, something that the client needed. When you click yes to any of those things, what's happening on the back end is that LinkU is actually pulling the resources for you in those areas. So as you saw at the beginning of this presentation, we went and found those resources one by one. Instead of doing that, now you can complete this needs assessment. And then by the time that you finish it, you would click review. And from there, a list of, you click review, you click submit, and then from there, a list of resources will show up. And it'll be in the areas that you have identified as issues for the client. So definitely a time saver instead of having to search for each of these things one by one. And so we really encourage everyone to take advantage of the needs assessment. So that way, if you know a client has a lot of different things going on and needs a lot of different types of resources, you can have it all in one kind of place where you can start making the referrals. It'll be a live page, just like similar to what we saw when um, we're searching for resources. So you'll actually, once it gives you the list of resources, you'll be able to make referrals from that page as well. Another great thing is that it will send an email to the client with all of those resources as well. So you'll get a copy and the client will get a copy in their email. The next place we're going to go is to right here where it says people I'm helping. Like I said earlier, LinkU acts as a small case management system for those who are using the staff site. And so when you want to go and see all of the clients that you're serving, as well as all of the clients that are being served by your team, because one of the advantages of being in a group here on the LinkU platform is that you'll be able to do cross coverage because you'll be able to see your colleagues' clients as well. So you would click up here where it says people I'm helping, click on people, and it will take you to this page here. Now, I just have a LinkU test client, but if I had a whole caseload of, let's say I was working with 15 different clients, you would see all 15 of my clients, as well as if I had colleagues that were working with clients, I would see all of their clients on this page too. So a helpful thing to do is to be able to just, if you know the client's name, just click John Smith, and then your client name, John Smith, hypothetically, would show up, and so you didn't have to kind of scroll through all the different clients if you didn't want to. So we're going to click on the LinkU test. And from here, you'll see, the client's profile. So this is what I mean by kind of a small case management system. So you have the client's sort of demographic information here. You see the client's goals to the right. You can see that you can actually make assignments. So you can actually assign clients to certain folks on your team. You can put some additional household information there. You can see all the different teams that you have and that you're associated with. You can even see the last assessment that you would have completed, and you can see the date of it. So the last assessment that I did for this particular test client was in 2020. So I could always view what those results were, but I can also say, 2020 was a while ago and I want to start a new assessment. So you can just click right here and start a new assessment versus having to go all the way back to the home page and navigate it that way. And then a really great thing is that you can upload documents. So maybe you want to upload the client's ID, or you want to upload their proof of insurance or their proof of residency. You can put all that right here. There's a couple ways that a client profile is created. So automatically, when you do a client assessment, a client profile is created. So when we did that assessment, then it gathered all that information and created this profile. So that's why it asks questions like first name, last name, address, zip code, all of those different things, because it was filling out this. You can always edit this information at any time. Another thing that it did is that it created treatment goals. So based on how you answered those questions, housing being an issue, food being an issue, maybe they don't have insurance or transportation, it automatically created goals for you based on how you answered the assessment. However, if there's additional goals that later you want to add, or even, maybe something wasn't covered in the assessment, you can always click the add goal button and then click on what kind of goal is this and choose some different options here. So let's say medical is something, and maybe the client wants to find a primary care physician. You can click here, and then that goal will be added to the list of goals that we have here. Um, an option that you can also do, so here's the medical find PCP, is that you can click on that goal and you can actually update the status. So maybe right now it's in progress, but later when you help them connect with a primary care physician, then you can put that the goal is done. Or maybe they no longer have this goal anymore. You can put that this is no longer a goal, or maybe they have some other priorities. You can always put that this goal is on hold. Another option, another feature to this is that you can add a note. So if you find, say, connected client to Unity Healthcare, you can put that here. And then you can see kind of where the goal is at that time. Again, this is really great for cross coverage. If you know you're going to be out for a long time or just even out at all, and you ask one of your colleagues to cover for you that's in the group, then they can see that, there's a PCP medical goal here that you've already connected them to Unity, and then they can start from there instead of having the client kind of start all the way at the beginning retelling their story. The last thing on this page that is great is the navigation history, which is where all of the referrals that you have made in the system are tracked and stored. So if, let's say, we did make a referral to Thrive DC, or we did make a referral to Damien Ministries, some of those organizations that we had saw in the beginning of this presentation, we would see that here, that those, what date those referrals went out and to who it went to, as far as the organization goes. Another great thing is that organizations can do what we call close the loop. So for those who have claimed their agency, enabled those referral features, and then we send a referral to them, they can go in the system and they can send a message back to us saying that, yes, I was able to get a hold of your client, or no, I made a phone call and no one has answered. And then all of those updates would be here too. Making a referral without doing an assessment will also create a client profile. So that's another way that a client profile will automatically be created. It won't have all of these features here. So these will be, all of these things filled out as far as goals and all of those things, because it's only a referral. So these will be areas in which you would manually put in information if you only make a referral and don't do the assessment. So just as a recap on the people I'm helping. So people I'm helping is located up here next to your name. Where it says people, you'll click people. You'll be able to see um, all of the information for your client. You'll be able to see their goals if you created, if you did a needs assessment. You'll be able to do assignments to different people on your team. You'll also be able to review old assessments, upload documents, update goals, and also keep track of your referrals that are here. Okay, moving on to analytics. So the great thing about LinkU is that you can look at your site analytics based on your agency. You can click Site Tools at the top, and then you'll click on Site Analytics to take you to this page. Now, I'm the LinkU contract administrator, so I have access to a lot of different reports that run. But the main one that people usually have access to and usually use is called this search activity report, in which once you click View Report, then this page will come up. So in the last 90 days, right now we are in November. In the last 90 days, it does it 90 days at a time. There's been 8,500 different searches across both platforms. And of those searches, we can see that 33% had to do with health, 25%, oops, just updating real quick. 25% of the searches were on housing, 20% on food. Now this changes from quarter to quarter. It really just depends on what's going on in the community, but we can also see the different terms that people are looking for. So when we think of 33% of searches being health, we can see that, 577 searches have to do with HIV, 300 have to do with the actual term food pantry, which is one of the things that we even search for. So you can kind of see exactly what people are typing in to better understand the needs of the community. You continue to scroll down. You can see the top 5 search terms, which is HIV testing, food pantry, housing, STD testing, and then help finding housing. And then you can even break it down into like what, counties are doing the most searches. So LinkU originated in DC. It also originated in the HIV administration, which is why you see a lot of the searches having to do with STDs and HIV, just because it's just been living in that department for the longest time compared to everyone else. But you can see that other counties use it on a regular basis too. And it even breaks it down by zip code. The last part of this particular report will show you a heat map, which is really great. So you can even zoom in to really get a good idea of like where searches are coming from. Most of the searches obviously were coming from the DC area, but you can see that there's a lot of searches happening on the Virginia side and happening on the Maryland side. So again, it kind of gives you an idea of, where searches are coming from and being able to make some programmatic decisions based on that. Like I said, there's a ton of other different reports available um, that you can, tap into. If there's any questions about how to pull up certain analytics for your agency, then you can reach out to me and we can talk that through to see how we might be able to create some customized reports for you or give you access to some existing reports that might meet those needs. But yeah, it's a really great way of understanding how many, I mean, there's even a report, how many referrals are coming to your agency? How many of those referrals are you closing the loop on? How many people have you served? How many people are searching for you just in general? So it's really great for organizations that are working on behalf of clients because they're able to see and use the analytics to make some informed decisions. The last thing I'm going to do is I'm going to go back to the home page, which is this DC Health button to the left. And from here, which you can do it on any page, but from here, um, if you are interested in claiming your agency, so you heard me speak several times about um, agencies who have done what we call claim their agency, so that way they can, have ownership of their posting. If you don't claim it, then that's fine. We'll still make sure to go to your posting every 6 months, just based on what's on your website, and update the listing. However, if you have new programs that are being implemented or services that are changing or hours that are changing, or you want to enable some of these advanced features like the referral button, or there's an intake button that you could enable. There's even an appointment button that you can enable so people can actually make appointments with someone at your agency. Then the way to do that is to go at the bottom of any screen that's on LinkU, click Claim Programs, and then it'll take you to this page here. You'll type in the name of your program. You could put your zip code if you know it. And then first, it's going to ask you if you see your program already here. And if it's already listed here, let's say, I was the DC Health Breast and Cervical Cancer, and I wanted to claim this. Then from there, you would click on I work here, and it'll take you to the next sort of steps to claim. I'm going to go back. If I don't see my program here, right, maybe I see my agency, but I don't see my program. So maybe there's a new support group that you guys have initiated for women, and you don't see that women support group listed on LinkU. You scroll down to the very bottom of that page, and it says can't find the program, and then it'll say suggest a new program. You click on suggest a new program, and then it'll take you here. And from here, you'll fill in this information, and then it'll take you through the steps to add a new program. At the bottom here, you can also, let's say that you're on LinkU. So that's how you claim a program. If you're trying to claim your own agency, claim your, some different programs, that's where you go. Any page will have the claim programs at the bottom of the page. Another feature or another option here too is just to suggest programs. So let's say maybe you're not even talking about your program, you're talking about a whole nother program that you don't work at, but you know it exists and you can't find it on LinkU. You can come down to the bottom of any page on LinkU again, click suggest program, and it'll bring you to this exact page as well. There's multiple ways to get to this page. So you click here, you put in the program name that you think it's, the state, as much information as you can put in, and then Find Help, which is the company that powers LinkU, will do their research to find that agency, find that program, and then add them to LinkU. They'll also circle back with you to let you know that that agency in that program has been added. So that way it kind of closes the loop with you as well too. This takes us to the end of our presentation for LinkU. I want to thank you so much for using LinkU and sitting through this demo of it. Of course, if you have any questions, please reach out, and we are more than happy to answer those for you and get you connected. If you have any questions about setting up your account or even, setting up your agency, again, please reach out. My name, we really hope that you find it useful and that you use LinkU for your online and resource needs. If you have any questions about either how to claim your agency or how to suggest a program or just how to utilize the platform in general or create an account, please don't hesitate to reach out. My email address is Ashley, ASHLEY Coleman, COLEMAN @dc.gov. You can reach out to me and I will assist you as much as I can. Thank you so much.